So this brings me to the order of the draw, which is an important thing to know if you're pulling multiple samples from a patient. There is a proper order in which we pull the tubes so that the results do not get skewed. And, as we discussed before, there are many things that can affect the accuracy or the results of a sample. And one of them is the order of the draw. So there is a correct way to do this. So the mnemonic that we use to remember the order of the draw is stop, light, red, stay, green, power, light, go. Stop, or S, stands for sterile. Light stands for light blue. Red is your red top tube. Stay is for your serum separator. Green is for your green top tube. Power is for your purple top tube. Light is for your light pink tube, which we won't see much in veterinary medicine. And go is for your gray top tube. So if you're pulling blood for a blood culture, we really want to make sure that we have a sterile sample if we're testing for some kind of bacteria in the blood. So if you're doing blood cultures, they should ultimately be the first thing that you pull from the patient. Blood culture bottles have an additive of a nutrient broth and an anticoagulant that keeps the blood from clotting. There are 3 different types of blood culture bottles. They come in anaerobic, aerobic, and fungal, and they do require lots of blood to fill them. The blue top tube should be immediately after the blood cultures or first if you're not doing blood cultures. The reason being, there's a few reasons. They're used in coag studies, so you want to get the blood before it clots. Also, the additive in the blue top tubes, the sodium citrate, binds to calcium. So, for example, if you get the sodium citrate blood into your serum separator by accident, what could happen is you would have a low calcium value because the sodium citrate is binding calcium. Another thing that might happen is EDTA is high in potassium, so that might affect your chemistry as well. So for those reasons, we want the blue top to be next in the order of the draw. The next tube to pull if you're pulling multiple tubes would be the red top tube. Again, these can be no additive or they can have the silica coating, which is the clot activator. And again, these are used for chemistries. And right after the clot activating tubes, you would have the serum separator, which has no additive. And again, because they're used for chemistries, you want to make sure that we don't get that sodium citrate from the blue top tube in there. After the serum separators comes the green top tube or the lithium heparin tubes. And again, these can be with gel or without. And something that the green top tubes, again, they have anticoagulants, so you wouldn't want that getting in your serum separator. And the purple top tube comes after the green top tube. Not only does the purple top tube have an anticoagulant that you wouldn't want to get in your serum separator, but these tubes are also high in potassium and they bind other ions like calcium. Okay, so remember your order of the draw, and remember that there are also other things that can influence sample results, being hemolysis, icterus, and lipemia. Like we discussed, certain medications can influence blood work, as well as sample handling or improper labeling. So remember to keep these things in mind as a technician when you are obtaining samples and running your tests.